because this is important.
Yeah, that's the whole key. So what they give you, they...
Yeah. Can definitely. We could do that.
Okay, all right, perfect. So we did some side-by-side testing yesterday with the GE and the Signal Life Fidelity 100. What were your thoughts when looking at it briefly without really evaluating totally, but what were your initial thoughts about it?
Well, first look, I was impressed with the clarity of the signal and the fact that when you exercise on the, with the standard filter recommended filter settings on the GE system, there's a lot of baseline fluctuation compared to the Fidelity 100. Pretty much held the baseline pretty well and still had a pretty good signal. So just first glance,
what would that mean to a doctor though, to have the baseline that's clearer as opposed to one that's not as clear?
Yeah. The ability to interpret the findings, I think, is pretty important. So clearly, if you're trying to make a reading of stress test findings, picking up ischemia, even arrhythmias, can make a difference. PR intervals, QT intervals, ST segment abnormalities, that's always a clear importance. So, at first glance, that's something that is important, and I think that's something we should look into further.
Now, tell us a little about your practice here. How many people you see, what you do? So you're basically heart facility here, basically. You specialize in the heart.
Yeah, I'm a cardiologist and cardiac electrophysiologist. I deal with patients with disease problems ranging from general cardiology problems to electrical problems of the heart. We have a program where we do disease prevention, so we deal with people with risk factors, with diabetes, hyperlipidemia, and so we are constantly doing evaluations of people with known disease and also people at risk for disease. So, we do lots of electrical studies, we do T-wave alternating studies, ECG stress, echo, nuclear stress, do interventional programs such as ablations, electrical studies, defibrillator implants. So we cover a broad range of diagnostic and therapeutic interventions, and so that's our area.
So tell me, we plan on maybe putting some Fidelity 100s in there. What type of use would you see this type of machine from a mobile standpoint? How valuable would that be to you? The possibility of being valuable.
Well, the possibilities, I think, are fairly broad, just off the top of my head. Certainly you can have this type of a device where you can easily evaluate a patient, from one visit to the other. Typically with our evaluation test, our stress test, it requires, extensive hookup, one certain room, one certain area. If you had a device that can bring a lot of modalities that's diffusely spread throughout the office, where my staff can walk into a room and have someone up and have it linked directly to the computer, that decreases time. So the amount of money that we reimburse may be fixed or declining over time, but our efficiency in doing these tests may improve. So it'll improve our efficiency in doing the work that we need to do.
Right. Great. Well, we thank you for your time, and we look forward to working with you very closely and doing some research and getting the Fidelity 100 out there. Thank you.